The network of people living with HIV and AIDS in Nigeria, Lagos State chapter, is calling on government at all levels to normalize baseline tests for members at no cost before administering antiretroviral medicines on them. The medical are the commemoration of the 2024 Lagos World AIDS Day. Abosede Aderemi reports.
Nobody should think people living with HIV are sick people.
Antiretroviral therapy, ART, is a game changer in helping people living with HIV lead normal lives.
By no other person but our state.
With support from donor agencies, the standard treatment, which consists of a combination of drugs, including tenofovir, lamivudine, and dolutegravir, popularly called TLD, is given free of cost to people receiving HIV treatment and care in government-owned and partner-supported facilities.
In Nigeria, it is said that HIV treatment is free. But the baseline test for HIV treatment is not free. And if people living with HIV do not take baseline tests before commencing on ARVs, it means they are endangering their lives.
But most of the state hospitals and the IPs, that is implementing partners, they will just give people the drug, and it is later on they may do the test after 6 months. And you know what it means. If you have taken the drug for 6 months and maybe there was already a damage, more damage would have been done in 6 months. So baseline should be among the things that need to be done early enough so that people will not end up, instead of helping the people to survive, the drug should not help people to die.
With declining global funding in the HIV response, governments at all levels are being encouraged to lead from the front.
The sustainability roadmap, in summary, is to assist the national response and also dovetailing to the state responses, to assist them to ensure that they are able, one, to attain epidemic control, two, to ensure that the transition away from donor funding into full government ownership.
How responsive is it that for a health challenge of this magnitude, it is still donor dependent? It shouldn't be so. Government is supposed to invest in this more, put more resources into it, so that government should own the response. When government owns the response, you will see that some of these targets that they put long ago will be reevaluated.
Stigma and discrimination are hurdles that must be overcome to support people living with HIV.
If people stop to stigmatize people and then everybody embrace and know that, hey, people living with HIV are normal people, people will come out. And if people are coming out and living in their normal life, nobody is afraid of anything, you will see that it will be easier to end it.
Key players here are hopeful that with the right policies in place and sustained support driven by government taking ownership of the HIV response, the 2030 target of ending AIDS would be achievable. Abosede Aderemi, TVC News, Lagos.